Hello friends, in this video we will talk about the histology of pituitary, thyroid and the parathyroid gland. Okay. So first we'll discuss pituitary gland, then thyroid and then parathyroid gland. First we will see the histology of the pituitary gland. This is a rough diagram to show you. So we are going to remember and identify three important structures. So when it comes to the histology of pituitary gland, there are three important structures. This one, alpha cells, beta cells and chromophobe cells. So let us try to identify in the diagram. This pink color cells which you are seeing, in the diagram you are seeing a number of pink color cells and blue color cells. Here the pink color cell is the alpha cell or the acidophil. The blue color cell here is the beta cell or the basophil. And this dark blue color dots, you are seeing a number of dark blue color dots here, here and here. These are nothing but our chromophobe cells. Okay. So what are the important features? Three important cells we have to remember: alpha cells or acidophils, beta cells or basophils and chromophobe cells. What is the meaning of chromophobe? Please remember, chromo means color, phobe means hate. These are color hating cells. They don't like to be stained through colors. Okay. So this is the histology of pituitary gland. And extra, okay, sinusoids, not very important, but still these are the, you're seeing the empty spaces or the cavities. Those are the sinusoids, and you're also seeing some good amount of blood vessels. So this is pituitary histology. Okay. Next, we will see the histology of the thyroid gland. So very important point number one, that is, it is lined by cuboidal epithelium. So please, when you're writing thyroid gland, I want you to mention first that there is a presence of the cuboidal epithelium. This is the very important feature. And here we are seeing the thyroid follicles. Here in this space we are seeing the thyroid follicle. Okay, that's where our hormones are present, T3, T4. Okay, and here we are seeing a number of blood vessels. We know, so if you go back to the gross anatomy of the thyroid gland, we might have appreciated regarding the blood vessels, right? What are the arteries we saw? Superior and inferior thyroid artery, thyroidia ema and accessory thyroid, right? So those are the things. So important is the cuboidal epithelium. Here we can see the thyroid follicles which are shaded, and we can also see a number of blood vessels. It has abundant amount of vascular supply, and we can see the parafollicular cells. Remember, parafollicular cells, para is within or between. So between these thyroid follicles we are seeing the parafollicular cells. So this is the histology of thyroid gland. Let us see with parathyroid gland. This is posterior to the thyroid gland. What are the important features we will see? We are seeing a number of small blue color cells here. This is the chief cells. All these all are the chief cells. Okay. This is the oxyphilic cells. They are very less in number. You can see just very few are there. Here we can see here the oxyphilic cells, and we are seeing a number of adipocytes or the adipose cells. So which is more? You can see adipose cells and the chief cells are more. So to sum up, three important features: chief cells, oxyphilic cells and adipose cells. So references from where I took the images. Okay. So thank you so much. I'll see you in the next video.